So let me know if you feel any pain or tenderness.
Okay.
And take a deep breath in, please. And release. Light palpations on your stomach. Just let me know if you feel any pain or tenderness.
Okay.
Now I'm going to go a little deeper.
Okay.
All right.
I'll begin by checking for temperature, texture, and moisture, and checking skin turgor. That checks for dehydration. Very good. I'll be looking at her nails. Those all look normal. And palpate for any lumps, any tenderness or swelling in her scalp, and her hair texture is, the moisture is good. It is not dry or brittle. Auricle, tragus, and lobes. Those look good. There's no ooziness, no tenderness upon palpation. All right. Straight up and down. Any tenderness? All right, great. I'm going to feel for her thyroid. I'm going to assess her thyroid by having her swallow. Just a small sip while I make sure it goes up and down. Very good. And it did rise up and down. And I'm going to feel for any thrills, pulsations, chest rise, noting for the rise and fall of her breath, the rate and rhythm. Now I'm going to palpate. Please let me know if you feel anything that's tender in this area. Okay. All right, next I'm going to percuss, preauricular, mandibular, mental, infraclavicular, or supraclavicular, excuse me, infraclavicular, the posterior axillary, central axillary, or anterior, central, posterior, and lateral. Anterior, central, posterior, and lateral.
Dr. Osborne, your name is Kat, LRQ.
And that was light palpation. Okay, now I'm going to go into the deep palpation. Any tenderness there? Okay. I'm going to go ahead and assess your chest for any thrills. No thrills rise. So I'm going to go ahead and feel for your carotids. Okay, and now I'm going to feel for your brachial, your radial, your femoral. Feel okay?
Mm-hmm.
Your shoulders, and your scapulus.
Mm-hmm.
I'm going to go ahead and assess your elbows. And while I'm doing this, I'm going to go for range of motion. Good. And your wrists, fingers. And then this side, elbows, range of motion, wrists, and your fingers. I'm going to palpate her head, noting her scalp, looking for any lesions, any scaliness of her scalp, any infestations, and palpating for any lumps, bumps, or tenderness. Is this tender?
Mm-hmm.
Okay. The auricle, tragus, and lobes. Noting for any discharge or tenderness. This is tender. Okay. Her trachea is midline. I'm going to feel for her thyroid. I'm going to feel for her thyroid. Okay, found it. I'm going to go ahead and have you take a sip of water. I'm going to do the water test where you take a drink, and I'm going to feel for any deviation in your veins. Okay, and it did go up and down as she swallowed. Here you go. Start with the occipital lymph nodes. There you go. Your preauricular, postauricular, your cervical chains, tonsillar, submandibular, and mental, your supraclavicular lymph nodes, your infraclavicular lymph nodes, and I'm going to test for your axillary lymph nodes, where I'm going to have you put your arm up here. I'm going to test for the central, posterior, anterior, and lateral. I'm going to do that bilaterally. Central, anterior, posterior, and lateral. Now I'm going to palpate for any tenderness. Let me know if anything is tender. I'm going to stay in the midline on her spine, not in her scapula, and I'll go laterally and midline. Any tenderness, I'm going to go ahead and palpate. Let me know if anything is sensitive. I'll do laterally. Okay, anything? I'm going to inspect your chest, feeling for any rise, any thrills, or heave. None is noted. Okay. And now her brachial, her radial, her femoral, her dorsopedialis, and her posterior tibial. Okay, while I'm down here, I'm going to be noting for any edema, any dependent swelling. There is none. It's warm, and a capillary refill is good, less than 3 seconds. Very good. This is a light touch. Let me know if there's sensitivity anywhere. Okay, next is a deeper touch. Any sensitivity? I'm going to assess for any pain in joints, any sensitivity, any crepitus, or warmth, starting with her neck. Is that sensitive?
No.
Going down her spine and along her scapula. Sensitive? Nope. Okay. I'm going to start with her shoulders now and down to her elbows. Any sensitivity? Nope. Range of motion is good. Down to her wrists. Okay. And fingers. Okay.
Like to take the water in your mouth. And please swallow. That's excellent. I'm just going to quickly examine your neck, see if there's any lumps and bumps anywhere. Fine. And just over your clavicles. Right.
Now I'm going to start by palpating your head. Let me know if you have any tenderness.
Nope, it is good.
Okay, now I'm going to palpate your sinuses. Let me know if you have any tenderness here.
No.
Or here.
Nope.
I'm going to palpate your lymph nodes.
going to palpate your abdomen. I just want you to tell me if you have any pain or tenderness. Stop me here.
Nope.
No.
Feels okay.
Okay. Right over here.
Yeah, it feels fine.
No.
No, it's good.
Just relax your abdomen. Any pain when I do that? No. Okay, I'm just going to palpate your thyroid here, okay? Okay. One more time. You can go ahead and swallow. Okay, good. Alright, now I'm just going to palpate your carotid arteries. Good. Okay, good. Now I'm going to just test out your knees. Any pain? Any pain in your joints and your fingers?
Nope.
Okay. Check this in.
Is there any tenderness?
Nope.
I don't feel any nodules or anything. I'm taking a look at your scalp, and there's no lesions in your scalp, no pest inhabitants. Your hair is nice, neat, and clean. It's thick texture, and it is nice and smooth. It's gonna start right here. It's your preauricular. It's your postauricular occipital. And this is your submandibular. Here's your tonsillar. This is your superficial cervical, your posterior cervical, and your deep cervical. Relax your shoulders for me. And the supraclavicular. And I'm assessing your lymph nodes to make sure they're discrete. There's no masses. They're easily movable. Is anything tender? Okay. I'm going to check your thyroid. And to check your thyroid, I'm going to stand behind you. I'm going to palpate your trachea, which is midline. Tilt your head a little bit to the right. I'm going to deviate your trachea over to the right a little bit and palpate here. I'm feeling for any type of masses, anything tender?
Nope.
Okay, that's a normal finding for your thyroid. I'm going to do a light palpation, about 1 to 2 centimeters, and I'm basically assessing for the musculature and the structural part of your abdomen. I'm going to pause right here to see if I can feel your aortic pulsation. Is there anything tender?
Mm-hmm.
Okay. I feel no masses. There's no hernias and no tenderness. I'm going to go a little bit deeper now. Okay. This is going to go about 8 to 10 centimeters. A little bit. I'm assessing more of the structure of your organs for any type of masses, any distension, any tenderness. Which I'm feeling nothing.
Nope.
That feels good. Well, good. I'm going to palpate for your liver border now, okay, Lindsay? And what I'm going to do, I'm going to see, look in the midclavicular line, and you're going to feel me pressing in pretty deeply, okay? And take a deep breath in, and I'm feeling for the border there, and I can feel it right there. Okay, great. And it does not feel like it's enlarged. I'm going to palpate for your spleen.
Okay.
I'm going to give you some support back here.
Okay.
Okay. And I'm going to take my hand and I'm going to go obliquely and toward the axillary. And if you would, take a big deep breath and blow it out. Okay, good. Then I cannot palpate your spleen, which tells me you don't have splenomegaly, which is a good finding. I'm just going to palpate, and I'm feeling for any indentions, any crepitus, any tenderness, or any masses. So you let me know if anything that I do to you causes tenderness, okay?
Okay.
Okay, great. All right, I'm going to do a little bit of percussion. Take time to do a tactile firmitus. And what I'm feeling for is some vibration. So if you would say 99.
99.
And again.
99,
Uh-huh.
99, 99, 99, 99.
Okay.
Next, I'm going to light palpation, checking for tenderness or masses. Any tenderness?
No.
So abdomen is soft, non-distended, no tenderness noted. Now deeper palpation. Any tenderness? I'm going to attempt to palpate her liver. Take a deep breath for me and blow it out. Blow it all the way out. Okay. The liver is, I'm unable to palpate the liver. Unable to palpate the spleen or kidneys. I'm going to attempt to palpate the aorta. The aorta measures approximately 2 centimeters. Now I'm going to palpate for any inguinal lymph nodes in the vertical or horizontal groups. No palpable lymph nodes noted. Inspect for any lymph nodes. No palpable lymph nodes noted. This is checking for epitrochlear.
And I'm going to check her scalp. Again, checking mostly for any lesions or bumps or anything like that. And that all looks normal as well. And then I'm going to palpate the cranium. Again, checking for any bumps or abnormalities. Once again, I don't feel any of those. So now I'm going to check the temporal artery just to make sure I can feel that. And that feels good. I'm just going to palpate. Do you feel any tenderness with any of this?
No.
No? Alright, so I'm just going to go around. Any tenderness with this?
No.
No. There's also no inflammation of her lymph nodes. I'm just going to feel for your carotid pulses. Good, that one's nice and strong. That one's nice and strong as well, and a nice even rhythm. I'm just going to palpate a little bit. Is there any tenderness with that?
No.
Alright, good. And again, I don't feel any lumps or anything. Now I'm just going to feel your spinous processes. My thumb, just palpate those a little bit. Again, I'm just going to kind of palpate and feel. I don't feel any thrills or anything like that. So first, I'm going to start off soft. How does that feel? Okay, now I'm going to do deep. So tell me if there's any tenderness here.
Just a lot of blubber.
Oh, blubber, you know what? That's fine. More love.
All right, and I'm also palpitating for temperature, moisture. And I'm just going to take a pinch here, checking your tuger. Then I'm going to palpitate. Is there any tenderness?
No.
All right. Also looking for any infestation, feeling the texture of her hair, and looking at her scalp condition and any scaliness. Seeing if there's any drainage and lacerations. I'm going to also palpitate. Any tenderness? Okay. Palpitate her tragus. All right. Also going to palpitate your frontal sinus. Any tenderness?
No.
Maxillary. Any tenderness?
No.
Okay. All right, next I'm going to be inspecting her neck and seeing that her trachea is midline. Then I'm going to palpitate her thyroid. See that? I feel it there. And then we're going to do the swallow test. I'm going to have you swallow water and making sure that her larynx moves up and down smoothly. Okay? All right, and it does move up and down smoothly. I'm going to start with the preauricle. lymph nodes palpitating, and her post-auricle, tonsillar, her clavicular, anterior clavicular lymph nodes, submandible, submantle, supraclavicular, inferior clavicular, and also her axillary. Have you relax your arm. All right, I'm going to go deep central, feeling her lymph nodes here, posterior, anterior, and lateral. I'm going to do the other side. Feeling for deep central, anterior, posterior, and lateral lymph nodes. All right, next I'm going to palpitate for any tenderness. So let me know if you feel any tenderness. Anything?
No.
All right. Then I'm going to assess her thoracic expansion. I'm going to have you breathe in and out, and breathe in and out. And that was testing her thoracic expansion. I am going to palpitate. Let me know if you feel any tenderness. Anything? All right. And then I'm going to also test her thoracic chest expansion. I'm going to have you breathe in. Now, breathe in. And out. Fingers go apart, then back in, so the expansion is good. And I'm now going to percuss, okay? Starting up here above the clavicle area, percussing her anterior chest. And then the sides. All right. Now I'm going to listen to your breath sounds. You can take deep breaths. Let me know if you feel dizzy. All right. Next, I'm going to be assessing her heart. I'm going to see if I see any pulsations, heaves, or lifts, and I'm going to feel for any thrills, heaves, or lifts. And I'm going to palpitate the apical impulse. Right, Emery? All right, next, I'm going to listen to your heart sounds, okay? I'm going to start in the center intercostal space, listening to your aortic region. Pulmonic, tricuspid, and apical. All right, since I don't have a bell, adjust the diaphragm, I'm going to just do it one more time. But if I did have a bell, I would go back to those regions and listen again. Aortic, pulmonic, tricuspid, and mitral. All right. Next, I'm going to move to the peripheral vestibular. I'm going to be inspecting and palpating her pulses. Everything is going to be bilateral except her carotid. All right, I'm checking her carotid, then her brachial, and then her radial. And then also, I can also feel for your femoral. All right. And for the video, I'm going to just bring this down a little bit. I'm checking her dorsalis pedis and posterior tibial. All right. Feel any tenderness as I do this? This is the light palpitation. Then I'm going to do deep. Any tenderness? All right. Next, I'm going to be palpitating her joints, starting with her neck for any sensitivity, tenderness, warmth, crepitus. You can feel any? Down to her shoulders. Also with her shoulders, I'm checking her scapula. Her elbows. Any tenderness? Her wrist. And of course, all the joints in her fingers. Checking again, any tenderness, warmth, crepitus. All right. I'll check her hips once she stands up. I'm going to be checking her knees. Any tenderness? All right. And her ankles. And her toes.
I'm just going to look to see distribution, if it's, excess or absent and evenly distributed, and it is. Next, I'm going to check your skull, look at your scalp, and make sure you have no abnormalities. And it looks good. Let me check it. Check this side. Okay. Now I'm going to palpate your skull. Any of that sore? No. Okay. Headband's falling off. I'm sorry. Alright. I'm going to palpate your frontal and maxillary sinuses. Does any of that hurt? No. Okay. Palpate your face. Okay. Next, I'm going to have you swallow a cup of water. I'm going to watch your trachea. Okay, perfect. You can just hold that for a second. Now I'm just going to feel to make sure it's in line. And palpate your neck muscles at this time too. Okay. Now I want you to turn your head, look to the side, and kind of down, and take a sip of the water. Hold on, and don't keep it in your mouth. Don't swallow it until I tell you to. Okay. Okay, look down a little bit. Okay, now swallow. Perfect. The other side. Look down. Swallow. Perfect. Palpate for your temporal arteries, which are here, and your carotid. Okay. And then I already felt for your thigh. Next, I'm just going to palpate your lymph nodes, and you have your pre-auricle, your post-auricle, your occipital, right back here. Then you have your retropharyngeal, and your submandibular, and your submental. Then you have your infraclavicular, or intraclavicular cervical chain. No. Yeah. And your infraclavicular deep cervical chain, and your posterior cervical chain. And then you have your intraclavicular and your posterior clavicular. I'm just going to palpate your thorax, okay? You just tell me if you feel anything uncomfortable. Feels okay? Mm-hmm. Okay. So, just put my hand right up underneath you. Now, what I want you to do is take a deep breath in and then let it out, okay? Alright, good. Do the same for your spleen. Take a deep breath in. Okay, good. I can feel it, and that's normal. Okay? And next, I'm going to palpate in all of your four quadrants of your stomach, okay? Of your abdomen. Just tell me if you feel any pain, okay? check some of your joints at first, and this is going to be your TMJ, so you can just open and close your mouth. Okay, good. And this will be your neck, your shoulders, your elbow. Does any of that hurt? Okay. And your wrist, your fingers, this one. Okay. Check your knees, your ankles, and your toes. Whole feet. Yeah. Okay. Looking for C7. Just can you shut your head down? Just right there. That's C7.
Okay. Any pain?
Okay.
Any pain at all?
No.
Okay, very good. Alright, now I'm just going to feel your carotid arteries, okay? Just make sure that they're both equal. Alright, now I'm just going to feel. Just let me know if you have any pain, okay? No pain?
No.
Okay.
Good. Check them together. Good. Now I'm just going to feel for your nose. I'm going to go across here. Any enlarged lymph nodes, and everything feels fine. Okay. Just going to check your additional pulses here behind your knees. Okay. On top of your feet too. Good. On the other side. Good. Good. Okay, deep breath for me in. Good, and out. Good. Okay, same thing on this side, okay? Feeling for your spleen. Deep breath in. Good, and out. Good. Right now, while I'm over here, I'm gonna feel for your kidney, okay? I'm gonna push up and push down. Deep breath. Good. Blow it out and hold it. Good. Okay. Same thing on this side. Deep breath in. Deep breath out. And hold it. Good. Okay. Just gonna feel the middle here. Alright, you're all done. Thank you very much.
Okay. I'm gonna go ahead and fill your middle here first. Lift up for me. Okay. Just gonna feel some valves. Lift. Okay. Just let me know if you feel any discomfort, okay? Any discomfort with that? No. Just gonna press a little bit deeper, okay? Feel okay? Mm-hmm. Good. Alright, I'm just gonna feel around a little bit deeper. Might just be a little bit uncomfortable. I'm just feeling for your liver over here, okay? Just take a deep breath in and out. Okay. Just gonna do the same thing over here with your spleen. Big breath in and out. Okay. All Alright, I'm just going to do your kidneys. So with this, you'll just feel some pressure. You're going to breathe in and out and hold it, okay? Okay, I'm just going to come around to the other side. Big breath in and out and hold it. Alright, I'm just going to feel around in the middle here a little bit. Okay.
And just take a look at your skin real quick. I want to see your nails. She's got some nails on top of, but otherwise her capri fill looks good. Her skin looks good. Just gonna peel your sleeves up and check for any sort of abnormalities or lesions. Looks great. Okay, I just want to check your hair. Just looking at your hair, it looks shiny and clean. I don't see any lesions on the scalp. I'm just gonna feel your head. I don't feel any lumps or bumps or lesions. Good, okay? Your lymph nodes. Go, reach around back here. Wonderful. Let's get your cervical chain, your clavicular. Wonderful. One last thing, I'm going to come around behind you. I'm going to feel for your thyroid. Make sure that that's midline and in the right position, and that your trachea is also midline. Can you swallow? Wonderful. Trachea is midline and everything's in the right position.
Quick look at your legs. Obviously I'd like to expose the full legs. No pain there at all? No. No. Okay. Okay. Just going to have a look at your back as well. Okay, I'm just going to feel a bit deeper now. That's okay. Okay, can I get you to take a nice deep breath in for me? And out. Okay, and again. And out. Okay, and again. And out. That's brilliant. Okay, and again, nice deep breath in for me. And out. And again. And out. And again. And out. One more time. Okay, that's good.
May I touch you?
Yes.
Okay. If you just look forward for me. The hair is clean. I don't see any lice. Also don't feel any lumps. Is there any tenderness?
Mm-mm.
Okay. If you just look straight ahead. Look straight ahead. Any pain or tenderness? Okay. And tilt your head to the left and swallow for me. Okay. Tilt your head to the right and swallow for me. Okay. And then look forward and then swallow. Great. What I would like to do is I would like to show you what you would do is you would actually, it's almost like mowing a lawn. You would just use your fingertips, the pads of your fingers, and move down in a strip method across the breast, okay? And then also make sure that you feel the nipple and then the areola. Okay? Would you like to show it to me? Great. Excellent. Just hold this soldier. Any pain or tenderness? I'm going to go a little bit deeper, okay?
Okay.
Let me know if you feel any pain or tenderness. Okay. I feel for your liver. If you would take a deep breath in and hold it for me. Okay, and then exhale. I'm going to feel for your kidneys. Any pain or tenderness?
No.
Any pain or tenderness?
No.
And then I'll also take a look at her face, make sure there's none, and her scalp. Put my fingers in her hair, make sure I don't feel anything. Any tenderness or pain in the hair there?
No.
Okay, so these are going to be your pre-auricles and the post-auricles. Your occipital ones. Any pain, you're going to check for pain, swelling, anything that's hard and not movable. And she has no abnormalities noted along the lymph nodes. Any pain or discomfort with that? No. Okay. I'm going to check to see if it's swollen, or again if it has any masses on it, or if it's deviated from one side to the other. Everything feels intact there. Any pain or tenderness when I'm palpating there? No. So these were going to be kind of in this region. Sorry if I tickle you, I'm just going to reach under here. All right, again, nothing feels swollen or tender or painful there? No. Okay. And then we always check both sides to make sure there's not any abnormalities. One side compared to the other. Again, sorry if I tickle you. All right, very good. In the shoulder region there, no tenderness in here, and there's no masses noted, no. The next thing that we'll do is the light palpation. Well, the whole time we'll check her face to make sure that she's not showing any signs of it hurting her. At the same time, we could check over her bladder to make sure she's not having any pain over her bladder. And then the next time you come through, you push a little harder, checking the size of the internal organs. You can also check her artery, abdominal artery at this time for size or any pulsations. Is any of that bothering you? No. Or you no tenderness over your bladder? No. All right. Very anterior chest, again looking for lifts or heaves, and we can feel that. Palpate to make sure that she doesn't have any, like again, any lifts or heaves from her heart, and none of that is present there. So.
And just looking at Courtney's hair here, it's thin but evenly distributed. Any pain with that?
No.
Okay, so head is normocephalic atraumatic. Let me know if there's any pain or discomfort with this, okay?
Okay.
I should tilt your head this way and this way. And just lift up your shoulders like that. Okay, so all cervical lymph nodes were non-palpable. On inspection of the trachea, it appears midline, no deviations. Could you just flex your foot forward and swallow for me? And symmetrical rise and fall of the thyroid gland. I'm just going to head and palpate this. Let me know if there's any pain or discomfort with this.
Nope.
Okay, sorry, my hands are a little bit cold. And I'll get you to just lift your knees.
Okay.
Okay, and just let me know if there's any pain with this. No?
It's okay.
Okay, I'm going to go a little bit deeper. Okay, so no palpable masses in the abdomen. And I'm going to get you to take a breath in and out. And a breath in and out. And a breath in. Great, and out. Okay, so liver was palpated. The border was free of nodules.
Good. Let me know if you have any tenderness with this.
Okay.
Okay, let's do the other hand here. And again, let me know if you have any tenderness. Good. Okay. All right, let's move on to your shoulders. I'm just going to feel around again. Any tenderness? Pull this back here. Good. Okay. Feel your joints here. Gonna move over. Reach back again. No tenderness? Me pushing in a little bit, okay? No tenderness?
Nope.
Okay. Let me know if there's any tenderness here. Got some wiggly ones. All right. I'm gonna move on to your ankles here, okay? I'm just gonna feel around.
Okay.
No tenderness? Good. Okay. I'm gonna feel your joints down here as well. Sorry if this tickles. Okay. Good, and then the same on this side. And no tenderness?
No.
Sorry, I'm tickling your feet. Okay, wonderful. Good. All right, you're just gonna feel me feeling around a little bit. I'm gonna feel your muscles here. Let me know if you have any tenderness.
Okay.
Sorry. Okay, and we're just gonna touch your spine as well. So let me know if you have any tenderness here, okay? That feel okay? Okay. I'm just gonna work all the way down to your tailbone.
Okay.
No tenderness? Okay.
Palpating the cranium and hair as well as the scalp, and then I'm going to palpate the temporal mandibular joint. Can you open your mouth for me? Okay, good. And now I'm going to palpate the lymph nodes, so occipital, preauricular, postauricular, submandibular, submental, anterior cervical, posterior cervical, deep cervical, tonsillar, and supraclavicular. Alright, I'm going to palpate the bony landmarks on the back, especially for T3 right here, as well as the muscles. And I'm going to do tactile fremitus, so can you say 99?
99.
And again?
99.
Again?
99.
Now for the lateral.
99.
And one more.
99.
I'm going to palpate the bony landmarks, the clavicles, the ribs, and sternum, but especially the fourth rib right here, and on the chest. Okay, so now I'm going to palpate all the quadrants. So right upper quadrant, light, deep. Left upper quadrant, light, deep. Right lower quadrant, light, deep. Left lower quadrant, light, deep. Epigastrum, light, deep. And I'm going to palpate the liver.
Yeah. What did you measure over here?
That was the liver. So now I'm palpating the liver. And now the spleen with the hamburger method. And then can you roll over on your side?
Which one?
Right, towards me. All the way. And I'm palpating the spleen. So no splenomegaly, and as well as the kidneys. And then roll it around that side for me. And this kidney. Okay.
So I want to palpate your skull. You feel any kind of tenderness or pain when I do that, Brian?
No, it feels pretty good, actually.
Okay, all right. Most people tell us that. I don't see anything as far as any kind of flaking or no scalp problems or anything like that, right?
Right.
Okay, go ahead and I'm going to palpate your face. Any kind of pain or anything like that?
Nope.
Okay. All right, we'll look at your neck, looking at your shoulders, they're even height. Okay. I want you to, if you will, I want you to shrug your shoulders for me. Okay. That's actually assessing cranial nerve number 11, which is your accessory nerve. I want to palpate your trachea. Kind of pain or anything like that? Okay. All right. I want you to take a sip of water and hold it in your mouth. And I'm going to give you some directions about how to hold your head. And then when I ask you to, I want you to swallow for me. Okay. And I'm going to kind of stand behind you. Okay. I need you to put your head down and to the right for me. Okay. All right. Now I need you to do is swallow. Okay. All right. Can you do that for me one more time and then put it to the opposite side? There you go. Ahead. I'm going to palpate your carotids. Do them one at a time because I don't want you passing out on me. Okay. And while I'm here, I'm going to go ahead and do your temporals as well. Okay, sounds good. Okay, I am going to palpate your lymph nodes. It's not abnormal to have some lymph nodes that are enlarged, but you haven't noticed any changes, any discomfort from any lately? Okay, all right. These are your preauricular, your postauricular, your occipital, your retropharyngeal, your submaxillary, your submental. Okay, and if you will, turn your head for me this way, kind of tilt it to the side. It's your sternocleidomastoid muscle, and underneath this are your deep cervical chain. Okay, in front of this is your anterior cervical chain, your posterior cervical chain. Okay, we'll do that on the other side, so turn the other way for me. Okay, don't feel anything. Okay. And then I'm going to feel above your clavicles for your supraclavicular. Not a whole lot of room in there, Brian. And then below them for your infraclavicular. Okay, all right. Okay, let's move on and look at, let's go ahead and look at your ears. Don't do anything else. All I want to do is just look at them so that before that they're evenly placed, that the outside of your canvas lines up to the top of your ear. I want to palpate them. Any tenderness or pain with that?
No.
And I also want to palpate your tragus. Okay, I'm going to palpate, so I want you to tell me whether or not that you have any kind of pain or any tenderness.
No, you can roll a little harder.
No, I can roll a little harder. You have a lot of musculature back here, so it's really easy to feel the appropriate spots for being able to palpate. All right, what I'm going to do now is I want to make sure that you have what we call even symmetrical expansion, so that your lungs are rising and falling at the same tracheal. Wow, Brian, all the students need to check your pulses and check your radial. Nice and strong. Check
your radial hair. Okay, your popliteal, but we're not going to check those today. And then I'm going to check your posterior tibialis. And check your pedal. Yeah, you got good pulses, Brian.
Good deal.
All right, looks good. Okay, so I'm going to real lightly just palpate. Okay. And then we're going to do some deeper palpation, making sure that we've gotten all 4 quadrants again. First I want to, before I do deep palpation, I'm going to go ahead and I'm going to palpate to see whether or not that I can feel your liver. Okay. Sometimes you can feel the liver, but it's not uncommon for you not to. So just lay flat for me. I'm going to lift your back up just a touch. There we go. Okay, now lay back on. All right, so what I want you to do, Brian, is I want you to take a deep breath for me. All right, now I want you to let it out. Okay, I didn't feel anything except for muscle. So let's go over here on this side and let's feel the spleen. Okay, take a deep breath for me again. Okay, and let it out. Okay, okay. All right, so we're going to finish up with, we're going to do some deep palpation. Okay, again, still no discomfort or anything like that. Okay. All right, very good. So I'm going to palpate. I'm checking as well as checking your joints. I'm also checking your muscles, and I'm checking them for size, symmetry. Okay. Your hips.
Yeah, one by one.
Okay.
We are going to palpate the skull, making sure it's normal cephalic, that there's no masses or areas of tenderness. We're also going to palpate the hair while we're here, noting the texture of the hair distribution, that there's no areas of alopecia, and that the hair follicles are not easily removed when we run our fingers through the hair. Next, we're going to palpate the facial bones, noting for any masses or areas of tenderness. We're going to palpate the frontal sinuses and the maxillary sinuses. Any pressure to these areas? No. Okay. Next, I'm going to have you open and close your mouth. We're going to assess the temporal mandibular joints, checking for popping, clicking, or pain. Any pain with that activity? No. We're going to palpate the auricle, noting it's nice and smooth. No lesions, masses, or areas of tenderness. I'm going to be inspecting and palpating the skin for the musculature, the temperature, the color, and the hair distribution along the arms. I'm going to inspect the hands for the nails. The nail beds are all intact, that the nail beds are pink with no cyanosis. There's no clubbing of the fingers. Cap refill to the fingers is all brisk, less than 3 seconds. We're going to palpate the brachial pulses and the radial pulses, noting both intensity and amplitude. Now we're going to palpate the precordium, palpating the apex, the left sternal border, the base, and the apical pulse. Also during palpation, I'm going to palpate the anterior chest wall, noting for any areas of tenderness or masses. Additionally, we're going to palpate the infraclavicular nodes and the axillary nodes. Palpating for the abdominal organs, any masses or areas of tenderness. Now we're going to do some deep palpation, palpating for the same. Now, the right costal margin, we're going to do some deep palpation to palpate the liver border. On the opposite side.
palpate the spleen, which we should be unable to palpate. Over here, we're going to palpate the left kidney and the right kidney. Right here, if you'll lean up ever so slightly, we're going to palpate the abdominal muscles. Okay, and then lay back. Just going to palpate the aorta, noting for any pulsations. Okay. Skin color, skin temperature, skin that's intact, muscle tone, muscle mass, hair distribution along the legs, presence or in Terry's case, absence of any edema. We're also going to check the capillary refill of the toes, noting that it is brisk, less than 3 seconds to both feet. Now we are going to palpate some pulses. We're going to palpate the popliteal pulses, noting amplitude, rate, and rhythm. Posterior tibial and dorsalis pedis. Cervical spine. Any tenderness? No. I'm just making sure that the spine is midline.
I'm going to be palpating her cranium, her hair, her scalp, her temporomandibular joint, and all of her lymph nodes. So the lymph nodes are the preauricular, postauricular, occipital, submandibular, submental, tonsillar, anterior cervical, posterior cervical, deep cervical, and supraclavicular. Palpate your trachea and your thyroid. Can you lean forward and swallow for me? Okay. Palpate the bony landmarks and muscles and find T7. Right there. And palpating along the mid-axillary line muscles. I'm going to palpate the clavicles, the ribs, and the sternum, and find the right fourth rib. Right here. I'm going to palpate the precordium, the 4 cardiac points, and the PMI, and the carotid. So sorrel and the epigastrium. Now a little bit deeper. Okay. Now palpate your liver. Can you take a deep breath for me? And exhale. Okay. And spleen. Deep breath. And exhale. Can you roll over onto your right side for me? I'm going to do the spleen one more time. Deep breath. Exhale. Okay. And back on lay on your back. Okay. Kidneys. Not at all. Not at all. No. No. Okay, great.
Next, I'm going to look in your head, okay? And I'm looking for lesions, the color, and your hair, any swellings, any pain there?
No.
All right, how about right there?
No.
Okay. So finally on your face, I'm gonna check your lymph nodes, okay? Start right there. Any pain there?
Mm-mm.
Okay, how about there? How about the back of your ears?
No.
And here?
No pain.
How about there?
No.
How about there? Okay, and then right there.
No pain.
Good. There.
No pain.
And here. Good. And then I'm gonna slightly palpate just lightly. Any discomfort?
No.
Okay. Alrighty. Good. I do not feel any masses or lesions, okay? So now I'm gonna do the same thing but a little bit deeper, a little bit more pressure. Good. Tell me when you feel any pain or discomfort. And good. I'm gonna come back here and check on your liver. Okay.
And look at your scalp and your hair. Look for any bumps, lesions. Look at the color of her hair and the color of her scalp. Okay. Say that's about 2+ for each. If they're equal bilaterally. Okay, and they are. And then with the feet. Okay, strong, equal bilaterally. Okay.
Okay, thank you very much. Okay, any problems with that?
No.
Okay, I'm going to go a little bit deeper now. Okay, any problems there?
No.
All right. Now we're going to have a look for your liver and then your spleen.
Okay.
If you could breathe in for me, please, and out. Breathe in, and out. Breathe in, and out. Breathe in, and out. Breathe in, and out. Now same again, breathe in, and out. Breathe in, and out. Breathe in, breathe out. Breathe in, breathe out. Rest back. And again. I'm just going to press down hard. That's fine. Thank you very much.